Now back to our top story today. The trauma of the Oxford school shooting has really rippled across Metro Detroit in the past week. And then on top of that, we've learned there's actually a shortage of mental health professionals just when people are looking for ways to cope. Paula Tutman joins us live this afternoon with really how bad this shortage is. Paula?
Yeah, it really is. But first of all, let's just talk about mental health to begin with. I mean, there's a range, everywhere from anxiety to depression, all the way up to willing and able to do harm to self and others. So I printed this chart out because experts were telling me that when you talk about that range, most people generally fall into that struggling or coping, that just kind of into that area, and they just need tools to help them cope. But in Michigan, finding those tools to help can be very challenging. It could be a sign of the times, really as common as that sign right there. While we're accustomed to seeing these kinds of help wanted signs on every corner of every Michigan city, the shingle for mental health practitioners may not be as obvious, but the need is just as acute. Right now, today, there are estimates that there are up to 40% fewer actual mental health practitioners on the job than there were just before the start of the pandemic. Eric Doe is the CEO of Detroit Wayne Integrated Health Network.
Folks have choices now within your field, within all of the professions out here. There are other jobs that folks can do that would offer them more money, less headache, less work.
The reason is a perfect storm. Michigan changed licensing and certification requirements just before the pandemic slammed into the world. Because of COVID, testing was hard to complete because of facility closures, which means practitioners with years of experience were suddenly shut out of the profession because of the change in certification requirements or an inability to test back into the system.
Those requirements can sometimes be a little more perhaps burdensome to some extent.
And now let's talk about available beds for juvenile services. Dana Lassenby is the CEO of Oakland Community Health Network.
Let me tell you what we have in our region, which includes Livingston, Macomb, Monroe, Oakland, St. Clair, Washtenaw, and Wayne. We have less than 150 beds.
But that doesn't mean those beds are actually available today.
People can be denied admission. For example, if they don't have a female bed, they only have male beds available. On paper, it may work, right? But the reality is, even if a facility has a bed, if they don't have the staffing to support a child, or if the child has behaviors that they're not equipped to manage and support, a child can be denied admission.
Which means if a juvenile needs acute evaluation because their parents or guardians or an interested entity fears they may be a danger to themselves or others, they may not get immediate placement for evaluation. Yeah, you know what, this situation sounds dire, and it is, but it is not impossible. There are county organizations that are out there, public organizations willing to help you. In fact, our web team has put resources on the front page of clickondetroit.com. They will help you find placement. It may take a day or so, and it may not be in your immediate community, but they want you to know that the help is out there, and they are trying to help people who are on that other end of mental health issues, Karen.
A very real problem that really affects all of us. All right, thank you, Paula.